Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College. Today we're going to focus on nursing, but I don't want to be the only person to tell you how great the nursing profession is and can be. I wanted to bring on an expert, so I researched high and low, and I found the perfect person to represent all nurses. I'd like to introduce you to Adele Gutierrez, right here from Glen Cove, who is a registered senior nurse at the State University of New York, or Westbury campus. Adele has recently won the Cause for Applause Award and the culmination of a campus-wide nomination process and review by All Staff Forum. Adele, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome to you.
Thank you. It's a pleasure to be here.
So congratulations on the award. Can you tell me a little bit about this award?
It was a nomination. The name of it was Cause for Applause, and I really had no idea it was coming my way. So the day of, I'm also an EAP coordinator for staff and faculty at the university.
What is the EAP?
It's an employee assistance program. So it is, I basically volunteer. I'm trained as a coordinator, and I offer referrals, and confidential referrals to all staff and faculty. So
when you refer, this is only for faculty who are at the college, or what faculty is it that you're representing?
It's staff and faculty at the university
At the
itself.
university.
Yes. And that's a side, that's a side gig.
That's a side gig. So you're representing them for what cause? What exactly do you represent?
That set aside from my title as registered nurse at the Student Health Center at Old Westbury, I basically, I'm really a confidential resource that staff and faculty can go to should they need any referrals or for anything going on, family, grieving, any various things that can go on personally. I'm really just a resource person.
So you're there to hear their concerns or
Absolutely.
to refer them to other resources in the community?
To hear and refer into the community, absolutely.
Great. So tell me a pathway of how you became a nurse. How did it all begin for you?
I am the non-traditional nurse.
Okay.
I am the one who thought I was going to play guitar and be in the arts forever.
Do you really play guitar?
Yes, I do. I'm a singer-songwriter.
Oh, nice.
But aside from that, I realized in my early 30s, I need to do something. I had worked over a decade with adults with various disabilities for a non-for-profit. And I thought to myself, I need to take this a little step further. And I did just that. And I started at the community college level with the nursing program over at Suffolk. And what really built my interest was my sister is a nurse, and she was my grandmother's nurse at the time. And it really affected me. At the time, I did not know, but now I know that my grandmother, who was battling cancer, went into a seizure. My sister was able to handle it so delicately with no panic and ease. For me, I thought to myself, here it is. The light bulb went on. This is what I would like to do for somebody else.
That's great. So as a nurse, do you think it gave you the capacity to care in the way that you do in all areas of your life? So as you volunteer for different organizations, as you are sort of like a helper for faculty and other things that you're doing, do you think that nursing comes with you in everything that you do?
It really does. And I think as nurses, if I have any nurses here listening, we have this notion of we want to fix.
Right.
We want to help. And I think it is the perfect avenue or profession that I could have chosen for myself.
Yeah.
And I tell you, work does not feel like work. I serve the students at the University of Old Westbury. We offer them private, confidential primary care because we have medical doctors there. We have a nurse practitioner for sexual and reproductive services. And every day is really, if I can make somebody feel just a little better and have that positive encounter where that person walks away with just a little something, that's my thing. That's my jam.
That's wonderful.
That's what I do.
So when a student comes in on the Old Westbury campus to your office, do they need an insurance to be seen, or is them paying the bill as a student cover them for the services there that you provide?
Them paying a bill, it's actually a student health tuition fee, which actually covers our students for medical services and counseling, mental health, where they have unlimited sessions with therapists and unlimited visits at the university, including antibiotics. We do have a very small pharmacy where we give our students as per doctor order. So we're able to treat the everyday maybe nuances that can occur: upper respiratory infections, sinus infections, ear infections, pink eye, urinary tract infections.
Okay, so this is a full-blown
clinic
that you're offering.
Yes, not free of charge. It's $120 per semester for all these services.
That's excellent.
It's a blessing.
Excellent.
And I mean, to talk about making health accessible, accessibility is key. That's what our students want. That's what they verbalize, and that's what they need. And to be able to provide that in the community college, in the university college setting, or just in the college setting itself, what a blessing.
It is. It is. So do you find that you see students on a regular basis? And how many students do you see that come through your door on average?
On average a day, it could be anywhere between 25 to, at times we have in the 50s a day. And that's not to say we also have make appointments for students to follow up with the medical doctor. So it's from meeting the student, the experience that the student feels, or the patient, coming in, meeting our front administrative staff, to circling through, getting an appointment with the doctor, and being evaluated with the doctor on site with a walk-in visit, and then following up days later. The continuity of care, the education that we provide for the students helps them become better historians of their own medical history.
Yeah.
And especially consumers of the health insurance that they do have, should they need to navigate. We sit with them, help navigate what urgent cares covers what specialty, do you need referrals, and things of that nature. It's really such a dynamic group setting that we have there.
It sounds like it. Now, what happens once a student graduates? Do you refer then to other healthcare providers in the community at that point? Do you have the resources to refer students once they do graduate from the university?
The way we refer, it's not like a referral that's going to be accepted by insurance. So it's really referring and giving resources, the importance of preventative care, of having your yearly checkups. And so, yes, if a student voices something or we offer, we absolutely provide that service. And we even at times have alumni that come back that per se, I need CPR training.
Yeah.
Absolutely. Let's do it.
You offer CPR training too?
Yeah, and it's $25. We work with the American Heart Association for students. It looks great on the resume. We train all the RAs on campus and the RDs, Narcan training, CPR, and choking.
That's registered dietitians and respiratory therapists?
No, this is just really American Heart, CPR, and AED.
Okay.
Yeah.
Oh, okay.
Yeah.
Okay.
But those students that are going into the health field and perhaps need it for professional, the BLS, we offer that too for $10.
Oh, wow.
which is so great. And it's creating this accessibility where a student doesn't need to pay the $100+
Right.
for it's really neat what we're doing.
And is this model of care in the university similar to that you're familiar with in other places, or are you only familiar with the university where you're working?
Well, what we do is we look at other SUNY universities. What are they doing? Are they being innovative? How can we're always looking to improve ourselves. So with that being said, being in touch with other SUNY campuses, some do offer over-the-counter medication, but however, for example, if we're talking about Stony Brook Student Health Center, everything is done. They have their own pharmacy there. So a student does have to pay a certain amount and so forth. But the level of the care that we have, to my knowledge, I don't see it in other SUNY colleges.
Yeah, that's wonderful. You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you're learning about nursing. My guest today is Adele Gutierrez from Glen Cove, who is a registered senior nurse at the State University of New York, Westbury's campus. Adele has recently won the Cause for Applause Award, the culmination of a campus-wide nomination process and review by a staff forum. So, Adele, I understand that you also do some volunteer work. So tell me about the organization called Horse Ability. What is that?
Yeah, Horse Ability. They actually, it's therapeutic. They work with children with autism or teenagers with autism. So it's writing therapy. So far I'm in my training to really, if I'm just a walker, I'll walk alongside somebody, and depending upon the level of the individual, whether they're tactile or don't want to be touched, but I'm there for safety. So those are the services that they provide there. They also provide what they call hippotherapy. So it may be a softer looking saddle where it just kind of helps with the joints and just anybody who has some sort of limitations with mobility. It's just really great. Helps them with coordination, with balance. And it also gives individuals with autism just an opportunity to just be. And it's incredible. It really is.
Therein lies just something else that you're doing in nursing.
Yeah.
So
absolutely.
getting back to nursing, tell me your thoughts about completing a part-time nursing program. How did you convince someone that going to school part-time was worth the effort?
Oh, wow. It is worth the effort. What I needed to realize is I had done everything, not backwards, but perhaps let's just say non-traditionally. And long story short, motivating myself to be a single woman and saying, I'm going to take care of me, to go back part-time and say, wow, I completed my associates in nursing. I graduated. I didn't think I could do it. I didn't have that confidence. But I had family support, and a lot of people don't have important. That. And let's face it, I didn't have children. Again, I was single. But to commit and cry and feel the fear and do it anyway, and I finished it. I did my associates. Then I worked with the state. And then I got my bachelor's because it took me a while. I was like, online classes, I can definitely not do that. And no. I signed up and gave myself no choice but to show up. Yeah. And now I'm registered to now start my master's part-time.
Good for you.
Yeah. It's
so the associate degree program, a lot of people would think, oh, that's so simple. The program and, having an associate degree is so simple. I think that was the toughest part of my education. What about you? Did you find it to be challenging?
Yes.
Yeah.
Because it mattered.
Yes.
And I had to do do-overs.
Yes.
When I was in my early 20s, I'm like, what do you mean I got a D in intro to
It grows you up really quickly.
Yeah,
right?
Yes.
So that's good that you had the support of your family members that really helped you through the associate portion. And then the bachelor's portion, for the associate, you went where? What school?
Suffolk Community College.
You went to Suffolk. And then the bachelor's, you went?
I did it SUNY Canton online.
All the way. All the way. So then tuition was affordable for you?
Would you being
say
a
that?
state nurse, tuition was affordable because my union does offer reimbursement. So that in itself was just a blessing.
Yes. Yes. I understand it's important to you to build therapeutic relationships with patients and students. How important and how that sort of aligns again with nursing and building relationships and how those relationships just propel themselves. Do students ever come back and say thank you? Just for the relationships that you built with them, in the health, this health thing that you're doing at the university. Do they ever come back and you see them probably in your everyday life and you bump into someone? Do you see them never say thank you for that?
Yes.
That communication.
And that makes me feel like I'm doing what I'm supposed to be doing.
Yeah. Yes. So how important it is, I know that you talk about communication, community, and accessibility. What is it about those three things that speaks to you most?
Well, I think with communication, it's important to make people feel seen, valued, and heard. We talk about competence of care, continuity of care in nursing, and we also talk about diversity. Mm-hmm. And I think it's important down to building a trustful relationship with the patient, knowing their pronouns, or just knowing their first name, or remembering their name. There is so much like in our names, just to be seen and heard and valued. I hear you, I see you. You are somebody to me. You're not just anybody. You're unique in your own way. And I find that is how I treat the patients and the students. You had mentioned accessibility. Accessibility is just so important. We continually give resources where needed. I just really want to say that we are improving our center to be more welcoming to the transgender community. Yes. And it goes a long way, little things, having a pronoun pins next to the sign-in sheet and somebody can choose their pronoun pins. We cannot treat just a part of a person.
Got to treat the whole person.
We have to treat the whole person. Yeah. And I really do believe from the feedback that I get from our students at the university, we're on the right track.
Tell me about the podcast that you have.
Yes, I have an LGBTQ plus podcast. If you listen in, we're usually off the rails on that podcast, but it talks about community, encouragement, frustration, everything that we face as people who are all doing life together. But it's a platform where we can talk to people within our community or people who are making a difference in the community, where we can interview them. They're our rock stars. Mm-hmm. Mm-hmm. And it's homegrown. It's something small, and we like it like that. So it's nice.
So tell me something. I know that I do this all the time. Do you ever find yourself watching these medical dramas on TV and yelling at them and saying, "No, that's not how you do that"?
Yeah.
Like, are you kidding me right now? Yes. Seeing things done so incorrectly, and yet, this is, it's believable because it's on TV, but I know I've been there. Have you ever been there? And you said,
I have been there. And I have to tell you, just even the medical portions of General Hospital, really, I just can't.
Yeah, I know.
Yeah.
I know.
Yes.
I know. How do you handle, and this is always a challenge, how do you handle giving bad news to patients or their families? When maybe, the result of a test may be unexpectedly different than what the patient probably was, I guess, expecting. How do you give that? What is your technique?
When we're in the university setting, the worst news you can get is you have a sexually transmitted infection. Yeah. But I'm also a group home nurse, so I still work with adults with disabilities. And I think when we went through COVID, that was the most difficult, is as being the liaison between the family and with the hospital itself. With grace, I communicated with grace, with love. And when I get nervous, I tend to take up all the air out of the room and chat up all the empty spaces. Yeah. But I was quiet.
That's powerful.
To listen.
Just to be silent.
And even though on the phone there's that odd silent, I learned to kind of tell myself, Adele, this is okay. Mm-hmm. Let this person process because I'm here. And I'm two things. I'm willing and I'm available.
And I'm present.
And present.
I'm just there.
Yeah.
You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you're learning about nursing. My guest is Adele Gutierrez from Glen Cove, who is a registered senior nurse at the State University of New York's Old Westbury campus. Adele has recently won the Cause for Applause Award, the culmination of a campus-wide nomination process and review by a staff forum. When you talk about just being present with patients and communicating and all this that you do, it's so reflective of what even I do all the time and what I teach my students. Now, what do you say to someone who's afraid to go to the physician? Afraid because, I don't know what they're going to say to me. I don't know what they're going to find. What do you say to someone like that to get them to engage?
And that has come up so many times. Yeah. A student, for example, did not like to get blood taken. At all. Those are tough. There's a lot of fears out there. I say let's start with a virtual appointment if you can get one first. Get warmed up. Maybe create a relationship with your doctor. And maybe not all doctors are the right ones for you. Some maybe may talk over you. Some may not. Some may listen. Everyone has a different style, if you will. So start there. Or maybe, hey, why don't you bring somebody with you? Write down your questions or somebody that you feel comfortable with.
Referrals.
Yeah.
Yeah.
Yep.
Get a nurse practitioner. How about that one?
Exactly. Yeah. I know.
Right?
Yes. I'm applauding to that one.
Right.
So it's small steps, but in the right direction with the goal maybe being the end goal.
Right.
Showing up.
Right.
Maybe you may have to be really creative to get the blood work done.
I know that so many people, particularly women, are afraid to get a mammography done because they are afraid of, if someone in their family had cancer, they are so reluctant to, possibly it could be me. So getting them and that education is so important. How do you think nurses can really be more impactful with regard to really making healthcare forefront for the communities, I think, across the lifespan? What can we do? I mean, we are a very large profession.
I think having platforms just like this platform you have here to discuss these topics, I believe sharing our stories, there's nothing stronger than our stories. Really, preventative care, how important it is, that the fear of not getting checked really outweighs not getting it checked at all. Doesn't outweigh it, rather. But, we just did an episode on the podcast for Breast Cancer Awareness Month. And in talking to this individual before the show, my co-host and I, we went and got our mammograms done, okay?
To show them that it's okay.
Yeah.
Yeah.
And they said I had dense breasts. Okay. Well, hey, I have to go for a second. I guess they call it just a different radiograph. I have to go get checked up again. Do I feel nervous? Yes, but I'm doing it. I'm being proactive. And we did it. And that's something that I don't think, unless this individual shared their story and how much it's impacted them and her family, I probably would have put it off a little bit.
Yeah.
And I don't believe that nurses are the worst when it comes to self-care. I just think we are so other people focused.
That's a good point.
It's really difficult to kind of then get caught up to ourselves.
Yeah. I think that a lot of that also is because as nurses, we're so knowledgeable, and a lot of times we self-diagnose. We'll say, oh, there's an ache in my shoulder. Oh, that's nothing but, this, or, there's something. And instead of going to see our primary practitioner, I think that nurses, sometimes we do that.
Yes.
We self-diagnose and we do that to ourselves. But we really need to be as proactive as we teach. So, walk the walk, that we talk. So would you recommend nursing to other people, to young people who are thinking about pursuing nursing?
Yes. I'm applauding again, everyone. Absolutely. It is the most rewarding, and it could be because of the niche that I'm in. I'm a college health nurse, but it does not feel like work to me. It feels like I am doing life and I'm helping. I'm making a difference.
Yeah. Do you miss the bedside? working at the
Well,
bedside
I started
in
out
hospitals?
in psychiatric nursing. I worked at Pilgrim State.
Oh, you started psych.
Yeah.
Okay.
Yeah. So that was a lot of fun.
Yeah.
So that's where I started, and that was my scope. And then I realized, I didn't feel it was as rewarding as I thought it was going to feel. Okay. So then that's why I'm a college health nurse, and I've landed. So, but with that being said, absolutely. If there's a lot of things I was squeamish about blood too.
Yeah.
But you learn, because when it's somebody else that you're helping, it kind of shifts your perspective and your feelings.
Yeah. So do you think nursing is really transferable to so many different areas, so many different fields? As nurses, we can go anywhere. You were in the college setting, you was in the psych, in the med surg, corporate nursing. There's so many things that you're doing, and you're doing a podcast. Mm-hmm. So kudos to you being able to take that nursing and do so much with it. Mm-hmm. What are some of the things that you see in the future for yourself as a nurse?
Well, my master's in administration.
Okay.
So I'm hoping that I can move up within the university, and I'm just hoping to continue what we're doing, continue to have that diversity, equity, and inclusion that we all talk about in these organizations, but keep it to life, keep it moving.
Yes.
Keep it so people see it, they feel it, they hear it, and that when they walk in, we have students tell us, I've never had an experience like this at a doctor's office.
Isn't that something?
Yeah, and it's great.
What do you think that set it apart?
I believe, and I tell myself, it must be because we're not doing bedside, we're not doing med surg, and we're not so stretched for time. But I can sit down, and I'll sit and just face to face before I get on that computer and type away. And how are you doing today?
Yeah.
And great. Okay, so tell me what's bothering you.
Yes.
And just create that type of, communication, simple.
So how do we get in touch with you? Give me your web address or your www.
Well, regarding for Sunil Westbury, you can email me at Gutierrez, GUTIERREZA @oldwestbury.edu. You can give us a call there in the Student Health Center. We're at 516-876-3250. Even if you want to reach out to me and talk about nursing, you can also look us up on Mix Knish Podcast. We are just on everything, so you can just look up Mix Knish.
Well, thank you so much for being here, Adele Gutierrez from Glen Cove, who is a registered senior nurse at the State University of New York's Old Westbury campus. Thank you for giving us all this important information today, and thank you for promoting the amazing career choice of becoming a nurse. We love nurses. I love nurses.
Me too. Absolutely.
So thank you.
Thank you so much. Thanks for having me.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.